please welcome Karen Barrett of 1199. Karen, do I see you?
Good afternoon, labor leaders and my fellow comrades. It is a pleasure to be on this panel tonight. I represent 1199 members from Yonkers all the way up to into Westchester, Rockland, Putnam, Dutchess, Orange, Catskills, and I go over to Port Jervis. And then I switch over on the other side of the river and go into Ulster County into Kingston. Our members are on the front line and they're dealing with, first our issue is the PPE and getting the right equipment and getting these PPE for our members to protect themselves. Now they are living the reality of COVID and seeing their coworkers coming down with the virus and seeing some of them being incubated. They have to do these procedures on their own members, their own coworkers, and it's heartbreaking. Some have recovered, and we give God thanks for that. Some are still fighting the battle. It's really a challenge when we are trying to fight a crisis and where they don't see no end to this crisis. And I must give credit to some of the employers. They have worked wonderfully with us trying to navigate through this process, which is unprecedented that we are seeing. And they have worked tremendously alongside to make sure everything runs smoothly. However, there is nothing that is going to happen smoothly when it comes down to a crisis that nobody deals with. And we still have issues that we're working out when it comes on to our members being tested positive, and they have done the quarantine. Now they get returned back to work and they're coming up back positive again. And now management is saying, I can't pay for a next series of them being out because now I don't know how long they're going to be out, and we want them to utilize their time that they have in the bank in order to be paid. And these are no fault of these workers, and the workers are saying, no, we can't touch our time because we don't know how long this crisis is going to last. And by the time we get done, our banks will be depleted. So we are still facing that uphill battle. What do we do with the members who they go out, they do their quarantine time, they're back in the workforce, and now they're coming up back positive again? So that's a big challenge. The other challenge is on the mental health side of it, where our workers are calling, telling us that they're having nightmares, they can't sleep. They have seen so many people pass away in front of them that it's taking a toll on them mentally, emotionally, and physically. It's also taking a toll with them, with their family and their loved ones, because they're constantly out there on the battlefield and they're worried that they don't want to go home to their houses to bring this home to their families. So it's like a double whammy for them. They want to help. They're in the field to help people. They chose that profession, but then who is there to help them go through this crisis? Because they are torn in the sense that they're on the job and this is happening in front of them, and behind the closed door, they're breaking down. The challenges that we have, that we foresee moving forward, is that based on the budget, and this is where I call on our elected officials for help, because they're waiting out to see what the stimulus package is, and they are not willing to entertain the hazard pay that we are pushing for all healthcare workers. They want to divide the members in the sense that they want to choose who is essential from who is not essential. And I must give credit to my members, because if one thing I can tell you that has brought around, that the members are sticking up for each other inside their facility. So management will say, okay, we'll offer bonus bucks for the folks who are working in the crisis, but they forgot the housekeepers who are coming in to clean those rooms. They are still our members. They're still facing that crisis, but they look on the staff like the respiratory therapists, they'll give titles out. The respiratory therapists deserve this. The nurses deserve this. And they pick and choose titles. And the titles are pushing back and saying, no, all of our members deserve to be compensated It's not, I can't operate without the housekeeper. If he doesn't come in and sterilize and clean this room, guess what? All of us are contaminated inside here. So everybody deserves crisis pay. And that's the fight we're pushing currently right now in the Hudson Valley area. Our members are fighting. So far, we have not negotiated with any hospital who is willing. They're not saying they're not willing to entertain it, but they're not willing. They're waiting because they're either waiting to see what the stimulus package is going to be. And we know that they have already gotten some of the packages. And this is what we are saying to them. We know that you have gotten some of the funding already. Use that funding and give our members some relief. Our members did a campaign the other day to one of the employers, and they wrote them emails of their personal stories around this COVID crisis. One of our respiratory therapists, he wrote a letter to his CEO. It brings tears to his CEO face, because he said it's not about the money for him. It's about just appreciating the work that they do, and without even, they shouldn't even have to be asking for this crisis pay. This is something that they should have already considered doing for them, just as an appreciation for what the work that they're doing, you know. So it's a real struggle, and you know, we are in a fight right now to get this crisis pay. How long this is gonna last, nobody knows. And you know, with in Kingston, I'm faced with a shop that we just newly organized, and they don't even have a contract. But those workers are willing to fight, and we're willing to help them fight. And they are worried that because they don't have a contract, are they protected? What are their rights under the LRB to do this, to take on this fight? Because they're really fighting a monster who doesn't care about them. They just care about revenue and publicity right now. Nobody wants to be out there in the spotlight. Nobody wants a demonstration in front of their hospital say they're not doing the right thing. But then they want it on the hush-hush on the inside, and the workers must just work as if it's nothing and just go through the motion. And you know, the workers are saying, no, enough is enough. We need to be recognized. You're saying we are heroes, we are champions. Treat us that way. Don't just say it on the inside, but show us. That's what I have. Thank you.
Thank you. Thank you so much, Karen.